Dr. Awais Mushtaq here, MPhil scholar from Department of Pharmacy, Quaid-i-Azam University, Islamabad, and I have worked under the supervision of my respective supervisor, Dr. Fakhar. The title of my research is Co-Delivery of Chemotherapeutic Agents for Anti-leishmanial Effect in Vitro and In-vivo Analysis. Starting with the disease introduction, cutaneous leishmaniasis is actually a parasitic disease which is caused by intracellular protozoa named leishmania, and it transmits by the bite of female sandflies. My formulation, which is transferosomes, are actually deformable particles, which can be seen in the figure B, that transferosomes have the ability to deform their shape to enter into the stratum corneum, and after gaining entrance into the skin, they again reform into their original shape. They are composed of phospholipase and a surfactant which is called as adjectivator. It is known as adjectivator because it gives the ability to deform their shape to the transferosomes due to its long light carbon chain which is highly pliable. Then comes the lipid bilayer and hydrophilic core. I am using the combination of two drugs, antimicrobial peptide vancomycin and bactericidal antibiotic rifampicin. Vancomycin is hydrophilic drug, therefore it dissolves in inner hydrophilic core of the transferosomes, and rifampicin is lipophilic drug which is dissolved in the lipid bilayer of the transferosomes. Then comes the rationale of the study. Transferosomes, actually the rationale of my study is the avoidance of first pass effect and problems associated with parenteral route by providing localized drug delivery system by transporting drug to the stratum corneum. The aim of the study was to develop rifampicin and vancomycin co-loaded transferosomes for dermal delivery, and the objectives were preparation, characterization, and evaluation of rifampicin and vancomycin co-loaded transferosomes (RVCT) as well transferosomal gel (RVCT gel). Then comes the result of the zeta. The particle size was found 166.2, which was desirable because it is in the range of 100 to 200 nanometer. This size is required for the transferosome to reside inside the macrophages for targeting to the leishmania parasite. PDI is below 0.2.187, which indicates that particles are uniformly distributed. To support the result of zeta analysis, below is the figure of the transmission electron microscopy, which indicates that particles have uniform boundary, uniformly distributed, and circular particles. Zeta potential had negative charge due to the negative charge of phospholipon G used in the formulation. Then below is the figure of the X-ray diffraction. XRD study was done to check the crystallinity of the formulation. As it can be seen that there are no clear peaks in the vancomycin and lipid because they are not crystalline material, they are amorphous. And the clear crystals can be seen in the rifampicin because rifampicin is a crystalline molecule. And after the formulation, the rifampicins peaks have disappeared, which indicates that rifampicin have changed from crystalline to amorphous behavior, which increase the dissolution of our drug. Few indicates in the final formulation because of the unentrapped rifampicin. Then comes the in vitro drug release. I have performed the in vitro drug release at 2 pH 5.5, which is the pH of the skin, and 7.4, which is the physiological pH. Rifampicin release can be seen at the pH 5.4 and 7.4, and it is seen that drug release is much slower from RVCT gel and RVCT as compared to rifampicin and vancomycin co-loaded solution. The initial burst release is due to the unentrapped rifampicin in the outer core. The only difference between vancomycin and rifampicin drug release, which can be clearly seen, is the abrupt release. There is no abrupt release in the vancomycin graph as compared to the rifampicin, because I have told earlier that vancomycin is loaded in the inner core of the drug and it is not present in the outer layer. Therefore, there is no abrupt release of the drug. And we can see the sustained release behavior of our final formulation. Then I performed the ex-vivo permeation studies in France diffusion cells. In ex-vivo permeation studies, we can see that there's a clear difference between the RVC solution and RVCT and RVCT gel. Our drug, our final formulation and RVCT has more permeation as compared to the simple drug solution. Then I have performed the in vivo anti-leishmanial activity on the mice. Leishmania was induced in the mice, and that lion was treated with the RVCT gel, and RVC gel, and one group was the control. As it can be seen in the graph, that there is a clear difference between RVC gel and control group. And the further difference can be seen that RVCT has further reduced the lesion size as compared to the RVC gel. And RVCT gel has the largest decline in the layer size as compared to the other formulations. Then other table is of maximum inhibitory concentration values, and we can see that rifampicin values against pro-mastigote and mastigote's IC50 values are lower for the RVCT final formulation, which means that our final formulation has greater potency against pro-mastigotes and amastigotes as compared to the individual drugs and their combinations. Finally, it is concluded that we have prepared rifampicin and vancomycin co-loaded transferosomal gel was successfully developed for topical application to achieve dermal drug delivery against cutaneous leishmaniasis. At the end, I am thankful to the HEC for the provision of funds, and I am also very much grateful to my supervisor, Dr. Fakharuddin, and Professor Dr. Gul Majid Khan, Department of Pharmacy. Thank you.